Hello, my name is Alexandra Lazarou. I'm 14 years old and recently got my first dose of the COVID-19 vaccine. Some of my friends have gotten their first dose as well, but some are still not so sure. I'm really excited to sit down with Dr. Jonathan Hennessee from GBMC Health Partners at Padonia to get more information and answer some important questions kids my age have about the vaccine. Hi, Dr. Hennessee. Thanks for taking time to talk to me. I have a lot of questions for you. Are you ready?
I'm ready, Alexa. Thanks so much for this opportunity, and congratulations for getting your first dose.
Thank you so much. All right, Dr. Hennessee, I know that you have two kids of your own that are around my age, and I'm sure they have asked you this question, and some of your young patients might have as well. If our risk for COVID is so low, why should kids my age get the vaccine?
Alexa, this is a great question. And it's not quite so straightforward, maybe, as it would be with people who are in advanced age of life. But the reality is, there's still a risk of getting sick from COVID. You're right in that most kids, newborns to 18, luckily, have not been getting as sick and having as much mortality with COVID infections as people in later stages of life. But there are people getting sick. More importantly is the contribution to what we call herd immunity, which basically is contributing to decreasing the spread of the disease throughout society. It's to make sure everybody has the greatest opportunity to avoid infection. That was a long answer.
It was good. It was very informational. So I'm really glad you brought up me getting the Pfizer vaccine, because my next question is, why was the Pfizer vaccine the only one cleared for kids 12 to 15? And how many kids would you say was this vaccine tested on?
Yeah, so the answer about Pfizer versus Moderna or the other companies that have been making vaccines is that Pfizer's team just got to the finish line first, and the others will be there soon. So, we'll have more vaccine available to vaccinate the rest of the population in the United States as well as the rest of the world. And to answer your question about numbers, it was somewhere around, I know exactly, 2,260 people participated in the trial from ages 12 to 15. There had already been a trial with similar numbers from ages 16 through 25. And so when we say they participated in that trial, it means half of them got the vaccine and half got placebo. And interestingly, during that, that's what we call a phase 3 trial, over 3 months, 18 people in that placebo group caught COVID. So, it just goes to show that there's still a risk of getting COVID, and that risk can be to the individual itself or to individuals that are around that person that contracted the disease. Yeah.
So my next question for you is the amount of the vaccine that the kids gotten different than the adults, or is it the same?
It's actually the same so far in the groups the age groups that's been vaccinated. And they're currently working on other age groups, and trying to figure out what the right dose is for them. But right now, everybody's getting the same dose.
All right, thank you. So we've been talking about the vaccine, but someone asked, how is the COVID-19 vaccine different than the flu shot?
Yeah, so that we can get into some real science on that, but I'll try to make it a little bit more interesting. So it's actually pretty amazing. This new way that they've developed these vaccines, both Moderna and Pfizer. Initially, a long time ago, when they developed vaccines, they used the actual live virus, and then they started using what we call attenuated or dead viruses. And more recently, the technology has been to just use specific proteins of a virus, and we give that protein. This is similar to the flu shot, and they take proteins from those, and they make a cocktail, and they give us the vaccine. And then our body identifies those proteins as being foreign, and then creates antibodies. With the COVID vaccine from Moderna and Pfizer, It is different. It is a vaccine that packages little bits of information and it puts it into the body, and then your body, your cells. So our body then creates the protein, and then once it creates the protein, it creates antibodies, and antibodies are just your body's way of getting rid of things.
All right, thank you. That was a very, very good explanation and very informational for kids who might not know. So, some of my friends wanted to also ask, do you guys see the COVID-19 vaccine being annual, just like the flu shot? Do you guys see us going in like we do the flu shot every year and getting it again?
Yeah, it's a great question. We don't really know the answer to that yet. Part of the studies that are ongoing. So, we have these phases of studies in order to make sure things are safe and effective. But once they get approved, they continue to be studied. So what's happening now is those people that were in those studies are still getting checked. But it's different than the flu shot, because the flu shot, we have to do it every year because the flu virus mutates. Luckily, the COVID virus does not mutate as well as the flu virus. So it's not necessarily about new strains, at least not so far, thankfully. It's just about making sure that the antibodies last long.
So one of my friends wanted to know, since they're getting their shot very soon and they're not very like educated with some of the side effects, they wanted to know, what are the side effects of the shot and how long would you say it lasts?
Yeah. So I have some stats for you. 84% of people have pain at the site of injection. No duh, right? 63% of people report chills. Fatigue. 32% report chills. 24% report joint pain, just kind of achiness. 14% of people have fever. And those last for a day or two, and more so with the second shot than the first one. That's just a sign that your body's doing what it needs to do. It's a sign that your body's building immunity. It's ramping up to make those antibodies that will then just kind of swim around your body to detect if you get exposed. It's really a pretty well tolerated vaccine. Those things we think of as side effects that make you feel a little bit crummy after getting it are actually intended. And we shouldn't even think of them as side effects. We just think of them as the point is creating antibodies. Did you feel it? Have you felt any of those?
When I first got it, I kind of got really tired, but it was also because I didn't get very good sleep that night. So that might have been that. But right now, since I got it yesterday, I just feel like soreness in my arm where I got the vaccine. So that's really it.
Yeah, my son's 13 and he got his yesterday too. And the same thing. He was looking a little sluggish last night and wasn't really excited about getting up to do his algebra online today, but he's doing fine now, and I think he's going to go mow the lawn. So,
I understand exactly how he's feeling. I had to wake up and do math testing today, so that was not fun for me. The next question I have for you is, so the same person who asked about the side effects, they want to know what they can do before they get the shot to help them not have as bad as side effects. So like, what can they do to not feel as much pain or not get as tired?
Yeah, well, I think the first thing that we just figured out was making sure you get a good night's rest before getting it, right? That's just, the dad in me coming out. We don't really want you to pre-medicate with anything because we wouldn't want to decrease the response, your body's response. So again, we kind of want your body to ramp up a little bit, which may result in a little bit of, what people might call low-grade fever or feeling a little bit crummy or low energy. But if you do start to feel crummy later after you've been vaccinated, an hour or two later, you start to feel that way, or maybe it's later that night, it's okay to take Tylenol or ibuprofen. Most authorities are saying that's fine and probably not going to result in a lesser reaction or intended response to the vaccine.
So we talked about side effects, but we haven't really gotten to, we talked about short-term side effects, but what are some long-term side effects in the future we might be thinking that this vaccine could cause?
I don't think that there's really anything that there's a lot of misinformation about vaccines in general in terms of long-term side effects. And most of those have been debunked. The long-term ramifications of being sick from COVID is much higher. The first rule of practicing medicine is do no harm. And so I don't think you would have as many, physicians, nurse practitioners, and physicians assistants out there saying, please get this vaccine if we thought it was going to cause harm now or in the future. Certainly COVID infection can.
Yeah. A lot of the people were asking, like, we put it into a general question, but they were asking, like, could this cause infertility and stuff like that? And you just don't. No, maybe not.
Yeah, no, there's no reason to think that. In fact, right now, the American College of Gynecology is recommending that people who are pregnant get it. Initially, there was some question about whether or not they should. And again, the question is, would women who are pregnant and the babies they're carrying be worse off getting COVID? And the answer is absolutely. So the vaccine is, protective of getting the infection, which would be much more dangerous than anything the vaccine could cause. It's like wearing a mask, right? Like you wear a mask to protect yourself, but you also wear it to protect everybody around you. And hopefully, as we get more and more people vaccinated, we're gonna have less and less of that requirement, right?
Yeah.
Looking forward to that, right?
Yeah, I'm looking forward to it. And because I miss my friends, I wasn't able to see some of them because one of my close friends who I've known forever unfortunately got cancer during the pandemic, so I couldn't see her. And then my other friend, her grandma was really high risk, so it was really hard to see her at all.
Right.
So I'm really excited to finally be able to give them a hug
Right.
or even just see them.
But Leanne, right? And look at that. That's a sacrifice you made at the time for somebody else, right? And the same concept applies for getting the vaccine. People argue, well, it's not very much a risk to me, so why do I need to get it? But the reality is, it's a risk to others too, and by you getting it reduces their risk. So, it's a simple explanation that I think will appeal to most people.
I know you kind of talked about it, about kids who have sickness or going through cancer or did go through cancer or still battling it. So another question I have is there a possibility that the side effects of the shot may be worse for them if they had cancer or another sickness?
Probably not. If anything, they might be less, because if they are immunocompromised, then they're not going to develop as much of a response. So remember, I almost feel like we should talk about them not as side effects, but actually intended, right? So, you feel a little crummy, and we want that to happen to some degree, because we want, it's in some ways reassuring, I guess. Okay, I feel a little crummy. That means my body's responding and making antibodies. When you first get sick, that's what's happening. Your body's ramping things up.
Thank you. So my last question for today is for Dr. Hennessee is, how should kids approach conversations with their parents when their thoughts about getting the vaccine are a little different?
I love this question. It's a really important question because, unfortunately, from my perspective as a physician, it's not straightforward in everybody's mind to get vaccinated. And there's a lot of reasons for that. And misinformation, I think, is the biggest one. And kids may be in a position, and I say kids, I should say teenagers, or maybe in a position to have more information than their parents, or at least better information. And so I would encourage teenagers to, one, remember it's not an argument. So this is not something to go and debate or argue with their parents about, but rather to express how important it is to you as an individual to be vaccinated, for your physical health, your emotional health, and for the health of society around you. And use sources that your parents respect. Your local hospital, GBMC, if that's where you get your healthcare, or big name university research hospitals like Johns Hopkins or Mayo Clinic. Use resources from those institutions. Use news sources that your parents trust, because there's probably not a lot of real news sources out there that are saying don't get vaccinated, and have those references handy. I also recommend that you find an adult, preferably a family member, you could have that conversation So it's a three-way conversation to help, advocate for you. And lastly, you can always ask your parents, say, I'd like to get this, and I know you're skeptical, so can we make an appointment with my family doctor or my pediatric provider, and so we can all have a conversation and determine what's best for me. And that way, the doctor that's taking care of you growing up can help you communicate to your parents how important this is to getting life back to normal in a safe way. And again, the whole time, no argument. This is just a discussion, and you're much more likely to get your parents to be on your side about it.
Okay, thank you. That was a lot of amazing information today. So thank you, Dr. Hennessee, for taking the time to sit down with me and answer questions about the COVID-19 vaccine. I hope this will help my friends and other kids my age have a smarter conversations about the vaccine. But it was really nice to talk to you, and thank you so much for coming, and I hope you have an amazing day.
Thanks so much. You too, and congratulations on getting your first vaccine.
Thank you.